Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and today we are honored and privileged to have Dr.Ann Louise here, the First Lady of Nutrition, who came all the way here from Idaho to interview us about the future of chiropractic in the healthcare delivery system. Chiropractic's kind of been the secondary child of healthcare for the most part, and medical has been the #1 avenue towards healthcare delivery in this country for a long time, just because of long-term belief systems in our population. However, that tide is turning. When you say in,
very definitely.
Ann Louise, it is getting to be to where people want to get well naturally now from the inside out, as opposed to taking pills and potions and surgeries and taking things out of their bodies which they can't replace. So we're going to present a much more conservative approach of being primary healthcare providers, and then if you need drugs or surgery after that, we can always refer out for that. But people like us can help people retain and maintain their health naturally through eating properly and diet, nutrition, sleeping properly, eating properly, and also getting chiropractic care.
I agree.
And physical exercise is of course important as well. So Ann Louise has had some scoliosis off and on throughout her lifetime, so she's seen about 100 different doctors from my understanding.
Over 100.
Over 100. So she's going to let us work on her too while she's here. So let's check your posture first, Dr. Ann Louise. All right, now let's close your eyes and flex your head forward and backwards. She's not used to being on this end of the thing. Okay, that's good. Back to neutral. Now actually her posture is pretty good. She's just a little bit of rotation. That's probably from how she sleeps, mostly.
On my side.
On her side, yeah. You can tell how a person sleeps by just looking at their posture. She's got just a little translation down in her pelvis and low back, which is where the scoliosis is right there. Okay, but that's good. So we're not going to decompress her today. We're going to lay her face down and adjust her in the X, Y, and Z axes on this table with the drop pieces. So we are going to check her leg length, which is a vital important aspect of every patient's analysis. Her left leg is short by about 1/4 of an inch in this position. Now when I bring her legs up, it actually gets even right there. Does that tighten up a little bit in your lower back too, Ann?
No.
No?
Yes.
Oh, yes. That's what I thought. Okay, right here is a little sore in her pelvis, especially this right SI joint. These are the sacroiliac joints. This is the right one, and this is the left one. They're both tender, but the right one's a little worse, right?
Oh, much worse.
Yeah. So first thing we're going to do is adjust her right SI joint, and we're going to adjust it exactly in the plane of this joint, which is basically a 45-degree slant angle down and out. And then we're going to adjust the sacrum, which is the middle triangular shaped bone in the center of her pelvis. Adjust that straight superior to inferior in the Y and Z axes. And then the left side of the sacrum, and now the left SI joint, but I'm adjusting her hip on this side as well. There we go. And now her legs should be even, which they are. And let's see if they stay that way. Yep. And did that tighten up as much that time?
No.
Okay, good. So she's got a little bit of tightness and muscle soreness on this right side, so we're going to take it easy on her, and we're going to use this percussion vibratory instrument called Genie Rub, and what it does is just increases the circulation in these tissues. It starts the oxygen nutrition getting into the cells quicker, as well as the metabolic waste products of normal cellular metabolism get out through the cells quicker and into the blood so that they can expel the toxins from our body. And Dr. Ann Louise has written some great books on diet and detox that you should check out. In fact, that's really her famous forte, isn't it, Dr. Ann? And I'll show you those books here in just a second. Dr. Ann Louise and myself and some other chiropractors in the U.S. are going to be on a chiropractic documentary on Netflix and other television stations next year. They're shooting parts of it right now, which we are doing some of that right here now. But we'll be doing further more intense shooting of that when we did the interview process, as well as working with Dr. Jim Chester, who's the producer and director of it. He's out west too. I think he's climbing on the Continental Divide right now. Now, besides this increasing the circulation, this also gets the soft tissues to start softening up and remodeling, and that's really what we're going to be doing with Dr.Ann Louise, is remodeling her spine and her pelvis so that we can put her spine and pelvis back into a better biomechanical position so that she can function at a higher level through her nervous system. And that's really what chiropractic's all about. Long and short of it is, if the structure is lined up to where it's not impinging on the nervous system can function at a higher level of performance, and therefore the organs, muscles, tissues, and cells at the end of those nerves will function at a higher level as well, the way they were supposed to. As opposed to having pinched nerves out of the spine, going to your liver, or your colon, or your bladder, pancreas, whatever organ that nerve supplies. If that nerve is pinched, not getting 100% of the brain's message to that organ, the organ's not going to function at 100% of its capacity. And it eventually will develop into what we call dis-ease or disease. Chiropractors like to call it dis-ease because the body's really in homeostasis, at ease, in health. But when it's not healthy, it's in a state of dis-ease. That's a very common terminology amongst the, oh boy, did you feel that one?
Oh my God, to Chicago.
Yeah, that was, and there we go. See, we're not having to put a lot of pressure on these to get them to move today either. Good job. You're relaxing really good, breathing better. Let's get you all the way up in here.
Thank you.
Good job. Yep. Now see, she's moving great all through her spine. That's just perfect. Right here at the major apex of her scoliosis moved really well today too. I bet you that feels easier already. Yep. How'd that feel this time? Better?
Better.
Good.
Thank
Okay.
you.
Well, let's go ahead and turn you on your back now for me, please.
I want to stay.
Yeah. We haven't even.
Be done.
Yeah, everybody usually gives me a couple hours to quit that vibrator. It feels so good.
Should I take these earrings?
Yeah, you can if you'd like. Yep. There we go. And I'm going to start off over here on this left side and just relax this right in my hand here. Tilt left just a little bit. That's it.
Woo.
Perfect. Now tilt your head to the right just a little bit. Try to touch your right ear to your right shoulder. Okay, I got one more here. Just let this one go. Wiggle your right big toe. There we go. That's all she's going there. I don't ever force the vertebrae in place. If they're going to go, when you put the right line of drive and range of motion into it, if they don't move in that direction, they don't need to go. And it's not just the popping that's the adjustment. Woo, that's what a lot of people need to understand about chiropractic and chiropractors. It's about the direction and range of motion of those joints and making sure, no, you're okay there. Making sure that you're adjusting the patients with a short amplitude, a low amplitude, high velocity adjustment that does not go beyond that normal joint's range of motion so that the ligaments remain intact. Very good.
Lights are on.
Lights are turned on now. That's it. And now we're going to check her shoulder, which is moving pretty good without any crunchies in it. It's called crepitus, but we just lined up her glenohumeral joint on the right. A little more crunchies on this side, huh?
I don't know why.
Not as much. Well, it's probably from those years of you writing 30 bestseller books.
Thank you.
You don't have to thank me. You're the one that did all the work. There we go. We're going to show our fans some of those books for you too, if you don't mind.
Woo.
She was nice enough to bring along some of her books, and we might even get her to sign one for us before she leaves.
What a pleasure.
But here you go, let that just breathe and relax. Perfect.
Ooh.
Yeah, you're breathing much better, by the way.
Thank you.
Yes. So, which one of these do you think's the big one here? Go ahead and tell our YouTube subscribers and fans about it.
Hi, this is my first big bestseller. It's called The Fat Flush Plan. It started the detox revolution, where I spoke about how important it is to reset your body's metabolism with the right fats. How fats are much more important nutritionally than even carbohydrates.
And they're not all sinful and bad for you, right? Fats.
No, we're talking about
It's
the smart
essential to
fats.
have those, right?
And the essential fats.
Yep. And then there's another edition you did, Fat Flush for Life. That's more of a long-term plan, I assume.
It is, which talks about the seasons and eating according to the seasons and doing a fat flush for summer, fall, winter, and spring.
There you go. And this is the gut flush planning, which I think follows right in line with these, right?
It does. It's how you detox your digestive tract by getting rid of your yeast, your parasites, your food sensitivities, your mold, and your fungus.
And your gut has everything to do with your overall health potential.
Absolutely.
A lot of people don't realize that, but the gut function is absolutely essential for normal health. Well, this is your Houston chiropractor, Dr. Gregory Johnson, and we have here Dr.Ann Louise Gettleman, and she is known as the queen, not queen, but the, what is it, of nutrition?
First lady.
First lady of nutrition. I'm sorry. That's my fault, not hers. But anyway, we'll be seeing you in an interview real soon. We'll see you soon.